It's been a dry, hot summer, so chances are your lawn is in need of some care to keep it green and healthy. But a growing number of residents and municipalities are going organic, believing that pesticides may be linked to breast cancer. The lawn care industry says there is absolutely no proof. Now, there is one voice leading the charge that pesticides may contribute to cancer risk. In his new book, Nurture Nature, Nurture Health, Dr. Mitchell Gaynor, New York oncologist and founder of Gaynor Integrative Oncology, makes the case that a host of environmental factors, including lawn pesticides, have contributed to the dramatic rise in breast cancer rates. He spoke with me recently. Dr. Mitchell Gaynor, thanks so much for joining us this morning. The question is, do lawn care pesticides cause cancer? And in your new book, you do suggest the answer is yes. So where's the proof?
Well, I think if we look back, in 1995, the New York State Attorney General looked at the use of pesticides on golf courses in Long Island. Long Island is basically has one large aquifer where a lot of people get their drinking water. What they found is that 19.8% of the pesticides that were typically used on golf courses in Long Island were classified by the EPA as either possible or probable carcinogens, and 6 of those are capable of contaminating groundwater. And one myth that a lot of people have is that if you put pesticides and herbicides in your lawn, in your garden, that they stay there. There was a recent study in a journal called Environmental Health Perspectives where they looked at that, and they found that in about a day that the most commonly used herbicide was found on most indoor surfaces inside the home and in indoor air. Indoor surfaces include where you prepare your food, where you eat, where you brush your teeth.
But Dr. Gaynor, there's never been a study that has proven the link between pesticides and breast cancer. If there is a causal relationship, why can't it be proven?
Well, I think that in light of what we do know, the fact that those studies have not been and are not being done is absolutely remarkable.
So it's not that they can't prove it in a study, it's that the studies haven't been done.
That's right. And the standards are quite different. When the FDA approves a new drug, the standard is to prove it's safe for humans to use. But these things not only don't stay in the lawn and garden, they bioaccumulate within the human body. One of the places they bioaccumulate is fatty tissue, like human breast tissue and even human breast milk. DDT was first found in human breast milk in 1951, but it was not banned for 20 more years. In 1972, it was banned. A number of the pesticides and herbicides that have been used were only banned after there was proof of harm. So we need to test these the way the FDA tests drugs. We need to show proof of safety before these are released to our children and families, the way that drugs are tested. Also, they're only tested one at a time. They're not tested the way they're found in nature, which is multiply. So when you look at studies in terms of human breast tissue, human breast milk, there are many pesticides and herbicides that are in current use and which have been banned found in that tissue. And when we look at 1 in 7 women in this country having a lifetime risk of breast cancer, that's really atrocious. 1 in 3 people in this country will hear the words, "you have cancer," at some point in their life.
Dr. Mitchell Gaynor, thank you so much for joining us. The EPA, meanwhile, points out that there are currently no pesticides registered that are known human carcinogens. And the Long Island Breast Cancer Study is currently conducting a follow-up. Its aim to see whether pesticide exposure in any way influences cancer survival.